Morning. Welcome to South Dade Shoutout. My name is Richard Candia, and I am privileged to serve as a board member of the South Dade Chamber of Commerce. South Dade Shoutout is our opportunity to meet and speak with chamber members and businesses who help make South Dade the place to live, work, play, and prosper. And today we're joined by our friends of Monarch All Health. Ariel Fetier is a mental health therapist. She's currently finishing her doctorate over at Nova. Her areas of study and practice are numerous, but there is an emphasis at helping people truly understand why they're talking to you in the first place, I think. And Simon Senna is also pursuing his doctorate in clinical psychology, also at Nova. His areas of interest are also varied, but today the area that we're interested in talking to you about is brain health monitoring and how that complements the services that Monarch All Health provides. So good morning, guys.
Good morning.
Thank you very much for joining us. Our friends at Monarch All Health make us realize things that it's not easy to talk about in normal conversation. So I really appreciate you guys coming here. The basics. How bad did I miss out the introduction? Ariel, tell me a little more detail of what I can talk about, what we're going to talk about today.
Okay, first of all, you did great with the introduction, thank you.
Thank you.
But besides all that you said, really the only important part is that I work with children, adolescents, and families. And I do all types of therapy. So yeah, you got it. Mental health, last year in Nova, and I work with children, adolescents, and families.
What kind of details can you give me about what you're studying? Whoa, what you're studying and how that ties into the work that you do?
I'm studying clinical psychology, child, adolescent, family clinical psychology. I have a focus on trauma, working with children who've experienced any type of significant change, abuse, neglect, anything like that, or serious emotional difficulty, so depression, anxiety. I focus a lot on marginalized communities, so ethnic and racial minorities, LGBTQ, and that's essentially the populations that I get to work with.
There's some imposed stresses from being part of those communities.
Yes.
Now, before we go to Simon, Simon works with brain health monitoring. How do you use brain health monitoring? And then we'll go to Simon to explain what brain health monitoring is.
So I use brain health monitoring to kind of illustrate and guide the types of treatments that I do with the populations that I work with. So when Simon is able to explain what it is, essentially he provides measures and screeners to the patients, and I use the results that he discusses with them to kind of illustrate a pretty guidebook on where we should be focusing, where we should go for a treatment, what the goals of treatment should be, and if there are any stuck points, what they look like, what we should do about them, and things like that. So it's pretty much my guidebook.
Simon, so you can be an important component. Talk to me about brain health monitoring specifically and how that looks like to the patient. What does it look like?
Yes, so brain health monitoring, it's an in-house program we offer here at Monarch All Health, and Ariel hit a couple of those points pretty head on. So it's twofold in a sense. With what Ariel is describing, one component is, okay, say someone's coming in for some type of talk therapy and they're dealing with symptoms of, say, depression, anxiety, or so forth. You want to be able to understand how intense those symptoms are. So the types of different questionnaires you would provide with Brain Health Monitor, think more pen and paper sort of a format, helps us understand exactly how severe those symptoms are, what types of symptoms they're experiencing, because say if someone has depression, it can look different from person to person. So we get a good understanding as to how that depression looks, and that tells Ariel and other therapists, okay, how can we best approach our treatment? How can we best make our therapy fit the patient? In addition to that, there's something called progress monitoring that Brain Health Monitor offers. So the goal here is, say I meet with a patient, say Ariel may refer a patient to me, I meet with them, we do a couple of these questionnaires, screeners, measures, if you will. With that, At time point 1, when we administer all those measures, we get the results, we discuss them so that the patient and the therapist has an understanding of what's happening. I'd like to meet with the patient again, say, generally every 1 or 2 months, depending on what's appropriate for their treatment. Re-administer those same measures and get understanding from time point 1 to time point 2 to time point 3 and so on, how they've progressed over time. So if we're really looking at symptoms of depression, have they decreased over time? Have they increased, or have they kind of stayed steady?
So brain health monitoring seems to be an opt-in for the patient. So Ariel, what's the common denominator between those that choose to use brain health monitoring as part of their service treatment and those versus those who do not?
Well, one thing they both have in common is the fact that they're both seeking treatment for some type of difficulty. So whether it's an emotional difficulty, whether it's occupational difficulty, social, academic, they're seeking treatment for a reason. Those who opt in, typically it's because they want to see their progress a little bit differently, or because they want to see their progress in general. It's hard to monitor your own progress with so much that you have going on, especially because I work with children and adolescents. It's hard to ask them, hey, have you noticed a change? If they're 13, they're going to go, I don't know. So when you have brain health monitoring program, now we can present it to them. Okay, month 1, you were over here with your depression. Month 2, you were over here. It seems like you got better. Have you noticed this? So both groups are pretty similar, except one had asked or was referred, and the other one just said no.
I kind of like the idea of being able to see something in writing, perhaps,
Right.
that may not be available to you in your traditional treatment. Gotta stop saying the ums. Can you give me your thoughts about how this additional check will help give somebody a better experience in their therapy engagement? Simon, would you give me your thoughts there?
I think it goes back to a lot of what Ariel just said too, especially with working with children and adolescents. They may not necessarily have that insight about their own progress, how they've done in treatment. But with Brain Health Monitor, we're giving pretty clear data as to say, hey, this is what's happening. And with that data, we can better use that to say, okay, well, say if we're not doing as well as we hope to do, how can we adjust whatever we're doing in the therapy to better help that patient?
Okay. And my question to you, Ariel, it's kind of what Simon already said, but the insights that patients will gain from the results of and is it a monthly change or whatever the regular schedule is to sit down with Simon and do the...
It depends on the patient. Some of them, I would say a good amount are monthly, but depending on what their needs are, it could be biweekly too. It just depends on what their needs are and where we need to meet them. A good metaphor, I guess, to illustrate what we're talking about is if you were a student in a classroom and you're reading the board and it's a little bit blurry, you can see most of it, but you can't see all of it. So you ask your classmates what they say, you compare notes, and you're still getting A's and B's, but you need to compensate a little bit more. Versus if you had glasses, you wouldn't need to go the extra mile. Brain health monitoring is like the glasses. So we can still get to the results. We can still do our treatment. Brain health monitoring just helps make it a little bit easier for everyone, makes it a little bit fluid, because now you can see, you don't have to rely on yourself to check for progress, and you don't have to rely on us to notice if there's a change. And if we do notice, even that is still finicky, because you have to be able to tell us why there's a change, versus if you're completing all these measures and these screeners on a regular basis, it'll ask you specifically, and now you get to see, oh, wow, last month I was feeling a lot more sad and I didn't even realize. So now it opens the door to what was going on last month. Oh, I had a lot more to do at work. Okay, tell me about it. And now we can talk about it, versus me going, how are you feeling? And you're going, the same.
Right.
And it's like, you aren't feeling the same, but you wouldn't know.
You guys give the best examples. They must give you a class on using them, because I can understand it better.
Wonderful.
That was a really good gig. Write that down. Yeah, write that down. and something else that just occurred to me is by having those kind of regular tests, because these are actual tests that not a test, but
Like questionnaires.
a questionnaire.
Yeah.
It's sort of an accountability measure that I can use and to gauge. And well, there's no right or wrong, but you answered it in this way. So what were you feeling when you answered that way?
Exactly.
Yes, it definitely invites some more exploration as to why they answered the way they did. And I think, like Ariel put it too, it just gives some more understanding what's going on in that moment and how can we help generate that awareness as to how these patients are doing.
I had asked you, Simon, earlier about this feature, and it's not something that's necessarily a practice that all therapists are doing. What do you hope will come of this I'm not going to say experiment, but of this of offering this in the with your patients? What do you hope it's going to become a little more mainstream? Do you see something like this being a tool that other therapists will see as valuable?
Absolutely.
How does this work?
Absolutely. This service, when we first implemented the service, we did a little bit of research and we saw how progress monitoring, that this type of setup is fairly new, and it has a lot of support as to say, this is how we can help enhance our treatment, how we can help make it better. So I think in the future, there are a couple of limitations at the moment. This is still a pretty young program. I'm one of the only providers who's working on Brain Health Monitor, but we hope to expand it and be able to include things beyond my own limitations, right? So for example, I'm only English speaking. We want to be able to get Spanish speaking and other language speaking providers so we can help access different areas of our community.
We had, before we went on air, we were talking about how maybe some cultural differences perhaps, and I'm wondering, mental health, speaking about mental health just in general, where you guys are already helping to break walls down and go into new frontiers, adding this, I don't know if I want to see my answers written down. I don't know if I want to have a hard copy of my answers, but then maybe perhaps it might help broach the subject a little easier. Have you thought about that at all, maybe?
That's a really good point. I think that people are more open to tests, even if it's just as small as a questionnaire, rather than sitting and talking about things. I think it's a little bit more uncomfortable for them to kind of have to go through, well, I've been feeling really sad and I've been feeling like this, versus them just answering questions honestly. And that kind of opens the door for conversations that were a little bit more uncomfortable. So I think not only do we break a lot of barriers just by talking about it, but by opening the door for them to just fill this out, just answer as honestly as possible. Now we can review the results and we can compare too with maybe what you previously said, or does this match up with what brought you here in the first place? I think it's a little bit more comfortable for them.
Well, one of the things that I love about Monarch All Health is the opportunity that's given people like myself just to have this kind of conversation. Southdate, I don't know if this is going to be fair, but Southdate has, we're a little more insular. Our community is a little more tight knit, and I think there's some challenges in Southdate, and the fact that you guys are there doing this kind of new approach speaks volumes as to what we're doing in Southdate and the kind of services that are available to all of us, all the residents of Southdate. Rachel, there you go. Thank you, Rachel, for putting. She's scrolling all the information on the bottom there. So, Simon, does practice make perfect? In other words, as we're going through, I just thought of the question. How long does the questionnaire take?
Yeah, so it depends on exactly that patient's difficulties, right? So some people may have problems with depression, anxiety, stress, so forth. But generally, we want to keep it something that is brief. We don't want to necessarily scare people away by doing questionnaires upon questionnaires for hours upon hours. But generally, from the patients that I've seen, it would take average 1 to 2 hours.
Oh, wow.
With all the questionnaires.
With all those questionnaires.
So when you give a child a questionnaire, you want to make sure that it's within 15 minutes.
Yeah,
Otherwise,
man.
they're not going to want to do it. But pretty much he's talking about, let's say each of them are 15 minutes and I gave you like 4 and you took your time, and it's going to take about, an hour. So it's not like one takes an hour, but he's giving you, let's say you came in for depression. Alongside depression, what many people don't know is that depression and anxiety are hand in hand. They're siblings. So he might give you a measure on depression, and he'll also give you a measure on anxiety. Well, there are also measures that help to determine how much is it functioning your day-to-day life. Are you able to do your job right? Or if you're a child, are you having academic difficulties too? So there's a measure that will analyze that and examine that. So he'll give you one of those as well. So you end up having a good amount. I would say on average, like 4 to 5.
About around like 3 to 5. But that's the thing. And thank you for Ariel for pointing that out, because it's not just one questionnaire we're working on over an hour. That seems a little much. But we're trying to understand each type of difficulty you're having. So if it's, say, depression, but say you're also having problems with school or just trying to navigate the home environment, anything like that, eating as well. We want to have specific questionnaires that really lets us look into those areas, that provides us the glasses for those areas.
You are trained. You professionals are trained to, when you're speaking with a patient, to navigate around that impulse that a patient might have to give the answers that I think you want to hear. So how do you feel? Well, and I'll try to kind of couch my answers in such a way. And I know that in the conversation, you are trained to find the conflicts and find the where I'm being inconsistent. But in filling out a questionnaire, I would imagine that's even a bigger problem. Well, this is what they want to hear, and especially for a kid, how do you account for that?
I'm glad you point that out, because one, you want to make sure that the patient that you're with, the individual that you're with, feels that they can trust you, feels that they're comfortable around you. Because otherwise, I wouldn't imagine a kid to give me the most accurate answers if they don't have that level of comfort around me.
Kid, yep.
Or anyone, really, right? You have to be able to show them that you're genuinely there to help them. With that, with the questionnaires as well, it could be pretty easy to say, I'm just going to say I'm doing great here, here, and here, and then call it a day. But a lot of the questionnaires that we have also have different indicators that tell us, hey, you're kind of responding a little bit more positively than what most people would, or negatively than most people would.
Okay, because
so we can pick up on that.
Okay.
And we can ask those individuals, hey, we're noticing this. Let's try to have a bit of a discussion about this and see where it's coming from.
Note to self, don't exaggerate.
Yeah, I was just about to say, moral of the story, do not lie. We also have questionnaires that we can give family members. We also, especially when working with kids, we give a lot of questionnaires to teachers too, just to see where the discrepancies lie.
We don't stand a chance, all right.
Right, okay. So there's also client report, our behavioral observations. So we're trained to just look at you and see how you're behaving, and right.
I'm being judged right now. Thank you, guys. Thank you.
Right. So don't lie. Be truthful. You are seeking services for a reason. So if you try to show that you're a lot better off, at the end of the day, you're not getting what you came for. So
it's like going to the gym and just staying there 2 minutes.
Right.
I can do examples too. We've got a few minutes left, and I want to get your man, I got a couple of other questions. I just thought we'll have to do it for some other time. But I want to get your reaction to some of the triggers in mental health. And by the way, again, thank you. Monarch Health has been a constant reminder that these are things that should be talked about, that there's the stigma, whatever stigma, should be lifted away, and we all deserve an opportunity to live a better life. And part of that is taking care of our mental state. I'm going to give you some themes, and you tell me just really, really quick, on a scale of 1 to 10, how bad it can trigger mental health issues. Holiday season. 10.
Very much. Very much.
Yeah, that's right. Okay. Your relationship with alcohol.
I I would say
Yeah.
10, depending on the person, maybe 8, 7 for some, 10 for others.
Right. Using it as a way to treat depression is kind of counterintuitive, no?
Yeah.
Exactly. That,
Yes.
other substances or other behaviors like eating a lot or
That's my
using
next one.
drugs or anything like that.
Or some people eat less. Some people, when they feel depressed or anxious, they reduce the amount of food they eat, which isn't good either because your body needs the energy.
Who eats less?
A lot of people.
Stress. And wow, we don't even know we're stressed sometimes, right?
Yeah, and I think the holiday season too, it can very much focus on family time and reconnecting with family members. Sometimes that invites a lot of stress, or
Sure.
maybe the lack thereof too. So
Stress can also exacerbate a lot of problems you were already having. So let's say you were depressed and now, you just hit the worst time of the year for work. And so your stress is at an all-time high. It'll make the depression just feel that much greater. Stress exacerbates everything. It can also decrease your immune system, which will leave you susceptible to getting sick, which will lead you to feel worse. And it's just this horrible cycle.
Right. And then just life as a teenager, so much stress.
Yeah.
So they don't stand a chance. It's hard.
Teenage years are really hard. And
It's
I think
hard.
we become so far removed because, we're adults and adult life is hard. So I think we look at teenagers and we're like, you have no responsibilities. What could you be stressed about? But they have so many hormones just rushing through their body. Everything just feels so big all at once. And teenagers are really mean too. So you could probably be getting teased and bullied. A lot of self-esteem issues come to play, confidence. It's just, adolescence is hard.
It's hard. Life as a young person. I don't know. I mean, I don't know. Maybe I'm talking to young
No, it's
people here.
hard.
It's hard.
especially
hard.
with the stresses of our program, but even then too, it's like a lot of young people such as ourselves are really trying to find our identity, find out where we fit within the world, and that just can bring so much pressure.
You're balancing trying to be an adult while still being a student. So you're not really an adult yet because you're still in school, but you're also a grown-up, so you are an adult.
And where's that cutting? Where's the age of being a young adult? I don't know. If you're still in school, maybe I'm not an adult yet, and so I can go ahead and do stupid things.
Right, but then you're also in your mid to late 20s and you're going, no, you're a grown-up.
And then life as an older person, the people, empty nesters, you still have a career to have. Maybe you haven't accomplished a couple things, or you're trying to, when do I get on the off ramp? Those are challenges there as well.
Absolutely. I think every developmental stage, from a young kid to an older adult, everything in between, always has their own challenges specific to that phase of life that us at Monarch All Health, I will try the best to help each of those people navigate their way through.
On those tests, do you, taking the test, do you encourage giving your first reaction, answer the question, or do you allow them to take time, ponder, and maybe dangerously close to answering the way they think that you want to answer? Is there?
I think it really depends on the person. I mean, some people may just instinctively know how to respond to some of the questions, but some may need a little bit more time to think.
We're back to the trust thing as well.
Trust is a huge component of it. And I would say too, a lot of the different types of questions we ask maybe are things that may not even come up yet in therapy or in other areas of life. If I'm asking you specifically about any guilty feelings that you're experiencing, you may think, well, shoot, I don't know. I have to really examine that. I have to really look within myself and see if I am experiencing guilt or any other types of feelings.
Why did you look at me when you said guilt? No. That's right.
No lying.
Well, I want to thank you both very, very much for being here with us. Any last words, any last thoughts about just mental therapy in general, and perhaps your service in particular? Anything you want to leave us with, Ariel?
I want to say thank you so much for having us, because having these conversations is really important. There's still a really big stigma around therapy and an idea of what therapy looks like. And I think a lot of people have this idea that you're going to sit and talk for an hour straight and they run away from it. But that's not necessarily the case, especially with Simon's work. Not everything has to be talk therapy. There's behavioral therapy, art therapy. And sometimes just by filling out those measures, it gives us a better idea of what you need. And if what you need isn't sitting and talking for an hour, we can meet you there. But this is really important just to stimulate the conversation because a lot of people don't know. So I just wanted to say thank you.
No, thank you.
Yeah. And I don't know if I have any more to add, but that was wonderful. But yes, we'll try our best here at Monarch All Health to reach all the types of individuals in our community and help them lead a happier and healthier life.
I work in real estate, and any sales position, there's always this thing of accountability. The brain health monitoring is just another, you said progress monitoring, which I liked a lot. How do you know where you're at if you're not keeping track?
Exactly.
And I think that's a very, very powerful tool that you guys have. So congratulations. And thank you very much for joining us today, for joining us at South Dade Shout Out. I hope we were able to give you some insight on one of our great partners. Come back next week. Come see us. Come visit us. And remember, South Dade is the place to live, work, play, and prosper. Have a good day.